To the all-out effort to track down a murderer police describe as criminally insane. He is on the loose after escaping from a mental institution while out on a hospital field trip. ABC's Neil Karlinski has details.
The Spokane County Fair is traditionally a place for families to get together. But officials at a nearby mental institution that houses criminals somehow thought it was also the perfect setting for a field trip. And it was during that outing that a criminally insane convicted killer ditched his chaperones and vanished.
He's not somebody that has committed a crime out of passion. He's committed a crime because the voices in his head tell him to commit the crime. And we don't know when those voices are going to start talking to him again.
A police manhunt is now underway, searching everything from transient camps to railroad lines for 47-year-old Philip Arnold Paul. He'd been committed by reason of insanity for the killing of an elderly woman in 1987, and even his own brother says he's dangerous.
I have a concern because I don't feel that Philip's in a good mental state right now. At times he is. I just want people to be cautious, if they come across him, of course, call the police.
After learning of his escape, fairgoers were wondering why such a dangerous person was out in public in the first place.
It's pretty scary, especially having a 3-year-old son and a wife, with me.
It would have been nice for somebody to tell us that there's a killer on the loose at the fair. Nobody said anything. Everybody's walking around like nothing ever happened.
In fact, the local sheriff says officials from Eastern State Hospital waited a full 2 hours before calling police.
It is very frustrating, very surprising that we weren't put on notice immediately.
During that lag time, police say Paul was spotted wandering into this Spokane business and asking for a job application.
He came in here, asked me if we were hiring. I said not at the time, but we're accepting applications.
A review is now underway to determine why Paul was taken on a field trip in the first place. Investigators believe he is now headed to his parents' home about 150 miles away. They've been told his medication should keep him stable for a while. They're just hoping to find him before it wears off. For Good Morning America, Neil Karlinski, ABC News, Seattle.
And joining us now, Sheriff Ozzie Knezovich of the Spokane County Sheriff's Department. Sheriff, thanks for joining us this morning. So what are you up against?
Good morning.
What are you up against with this man? How dangerous is he?
All the indications that we have, he has a very violent past. One of my deputies in 1990, when he escaped prior, was assaulted by this individual and ended up in surgery.
And some more details on the original crime, 87, slaying of an elderly woman who he soaked in gasoline to throw off dogs and then buried her in her own flower garden there. So when you talk about criminal insanity, it's a very complicated thing. It seems like he has the capacity to plot and follow through on plans. Was there any indication that he was planning this escape?
Based on the investigation that we've conducted, it appears that he may have been planning this for several weeks.
I understand that an investigation shows he had been ordering freeze-dried foods and that sort of thing. Is that what leads you to believe that?
We have information that he actually contacted people outside of Eastern State Hospital and asked them if they'd order the food for him, and so he could pre-station that food in various locations.
So what do you tell the public? Do you believe he's on the road? Do you think he's hiding out somewhere and waiting for it to die down?
One of the things that we tell the public right now is the fact that our biggest concern is bringing Mr. Paul back into custody, and we're working very diligently to do that. We're asking for any leads, any tips. If they see anything of suspicious nature, please call Crime Check or 911.
Did he have money on him?
He did. He had roughly $50 on him at the time he was at the fair.
And that's certainly enough to buy a bus ticket and whatnot. And we're also hearing reports that he was resistant to taking his medication. Neil mentioned that in his piece. What sort of medication is he on? How soon could it wear off?
That's one of the things that I'm unable to talk about because we're not quite sure exactly what medications he's on. We haven't been told by Eastern State Hospital as far as that particular item. One of the things that really concerns me is the fact that if he was non-compliant in taking his medications, what made anybody think that he'd be compliant on a field trip to the Spokane County Fair?
Yeah, Sheriff, I just have to ask, what was your reaction when you learned of this field trip? It wasn't just this man, Paul, but a couple dozen other patients from that hospital. We don't know how many of them were criminally violent, but your reaction when you heard about this?
My reaction when I heard about this happened when my pager went off informing us that we had a walk away from Eastern State Hospital at the fair, and the individual was a murderer and had been judged criminally insane. I was shocked. I could not believe that this had happened.
Because they're all in plain clothes and basically had, hospital workers. Have you talked to the hospital? Do they have any explanation on why they can justify this field trip with him?
I've talked to the Secretary of Department of Social and Health Services, and she is cooperating with us. She is looking into this matter, and she's looking into the questions that we need answered. One of those questions being, why was there a 2-hour delay before law enforcement was notified that this individual had walked away from that group?
Right.
A group of 31 individuals, and they were all in the same category. They had all been judged criminally insane.
And real quickly, we'll put up his picture one more time. If somebody sees this man, what should they do?
What they need to do is immediately call 911, or here locally, call Crime Check. And we need to have all information. We're tracking all viable leads. We had a team of law enforcement officers leave roughly an hour ago to check several leads within the area.
Right.
And we're working diligently to bring Mr. Paul back into custody.
Well, good luck on that search, Sheriff. Thanks so much for your time this morning.
Thank you.